Hi, welcome to our Pharma Topics channel. Our topic of discussion is antihypertensives acting through renin-angiotensin-aldosterone system. In this video, we are going to see about angiotensin converting enzyme inhibitors and angiotensin receptor blockers. Let us see this pathway first. Angiotensinogen is converted to angiotensin 1 and angiotensin 1 is converted to angiotensin 2. This angiotensin 2 has multiple actions. It causes vasoconstriction, increases the aldosterone production, causes salt water retention and increases the blood volume. So the angiotensin converting enzyme inhibitors block the conversion of angiotensin 1 to angiotensin 2. Apart from this, angiotensin receptor blockers are available. They act at the AT1 receptors. They reduce the functionalities of angiotensin 2. Let us see the angiotensin converting enzyme inhibitors further. This group inhibits the enzyme kinase 2 or otherwise called as angiotensin converting enzyme. So they decrease the activity of renin-angiotensin system, prevent the conversion, and this can decrease the action of angiotensin 1 but not angiotensin 2. The drugs in this category include captopril, enalapril, lisinopril, ramipril, perindopril, trandalopril, fosinopril and moexopril. All the ACE inhibitors are prodrugs except captopril and lisinopril. Enalapril is converted to metabolite enalaprilat. It is available as a separate drug meant for hypertensive emergencies given by IV route. Angiotensin converting enzyme inhibitors are used for multiple uses. It has treatment of hypertension, congestive heart failure, evolving myocardial infarction, diabetic nephropathy, diabetic retinopathy, and non-diabetic renal disease, and also in scleroderma crisis. Let us see the adverse effects of angiotensin converting enzyme inhibitors. The most common adverse effect is dry cough because the formation of bradykinin is increased by these drugs. So these drugs can cause hyperkalemia if used along with other agents which elevate the serum potassium, such as potassium sparing diuretics. And other adverse effects include rashes and dyschezia, that is altered taste sensation, and acute renal failure if used in bilateral renal artery stenosis. So we have to remember cough, hyperkalemia, rash, and decrease in blood pressure. So you can remember the prils with the code captopril. So cough, angioedema, all these are prodrugs except captopril and lisinopril. Then taste disturbances, orthostatic hypotension when combined with the diuretics. In pregnancy, contraindicated. Contraindicated in bilateral renal artery stenosis. Increases potassium and lowers the formation of angiotensin 2. So let us see about angiotensin receptor blockers. So angiotensin receptor blockers block the AT1 receptors. They decrease the output of sympathetic nervous system, increase the vasodilation of the vascular smooth muscles, and decreases the retention of sodium and water. Put together, they decrease the blood pressure. So losartan, these are all sartans: losartan, valsartan, irbesartan, candesartan, telmisartan, antagonizes the activity of angiotensin 2 at AT1 receptors. These drugs do not increase bradykinin, so does not cause a cough and angioedema. ARBs act at the distal site. They will inhibit the activity of RAS even when angiotensin 2 is generated by non-ACE pathway. So angiotensin receptor blockers could be clubbed with angiotensin converting enzyme inhibitors. All indications and adverse effects are same as angiotensin converting enzyme inhibitors, except they doesn't cause a cough and angioedema. Special features of losartan include it produces active metabolite, it has antiplatelet action due to competitive antagonism of TXA2, and it has a mild uricosuric effect. Telmisartan has additional PPAR gamma agonist activity. This activity can help. It is useful in patients with dysglycemia. I hope it's a very short information of angiotensin converting enzyme inhibitors and angiotensin receptor blockers. I hope it will be useful for you. Thank you for listening. Happy learning. Kindly share this to more of your friends. Kindly subscribe to our Pharma Topics channel. If you like this video, kindly press the like button and encourage us. Thank you.